Dr. Tom Tarter, thank you for joining us on the Illinois Channel.
Well, thank you for having me.
You are a Republican candidate for the U.S. Senate, and we wanted to take a dive into some of your policy positions and some of your background. So many people are focusing, I think, on some of the other races, the race for president, maybe some of the contested congressional races around Illinois that some people forget that Senator Dick Durbin, who was first elected to the U.S. Senate in 1996, is up for re-election this year, and the Republicans would love to take that seat. Why don't you tell us, just begin a little bit about who you are and why you decided to run for the U.S. Senate as your first campaign?
Well, my occupation is a urologist. There are 5 subspecialties in urology, and my specific area is oncology. So I've worked as a urologist and urologic oncologist in Central Illinois for 23 years. And I have raised my family in Central Illinois. I started out at the Carle Clinic in Champaign, and then I was recruited to the faculty of the medical school in Springfield, where I worked for 10 years. And then I joined a very large cancer group. Their main office is in Decatur. And I've had my last day of work as a urologist for the rest of my life 1 month ago.
And when you decided to run, what was the primary issue? Was it health care or other issues that you thought, I have to step up and do something about this?
Well, our family is political. My wife is a civil engineer. I married up, and she put me through a lot of my training as a field engineer. And the reason we're in Illinois is that she wanted to do graduate work in engineering at the University of Illinois, which is #1 in civil engineering in the country. And so she was going to develop software for bridge engineering applications. And that's how we ended up in Champaign. After we had kids, engineering went away, and my wife has done a lot of volunteer work. She's raised a lot of money for the Cancer Institute in Springfield and for the schools where my kids attended. And she also volunteered for the Sangamon County Republican Party. Over the last 15 years, we've done a lot of volunteer work for Republicans. We've always supported them financially with their fundraisers, and we've supported individual candidates. So we've always got an eye on the political scene. She's a precinct committeeman, and our young son, who just graduated from high school last year, announced that he wanted to have his own precinct. So he's been appointed. Now he's on the ballot for precinct committeeman in Chatham, Illinois. And looking out on the horizon, we didn't see anyone with name recognition or money who was going to challenge Dick Durbin. And my wife will deny it, but she planted the seed for me to run for United States Senator. The truth is, we talk a lot about politics, and I was completely alarmed by the Democrat plan for a single-payer healthcare system. So that was the initial impetus for me to jump into this race, but I didn't do it without thinking very carefully about it. I called the leadership in the Republican Party to ask if there was anyone with name recognition or money who was going to challenge Dick Durbin. And the answer was no. So I tested the waters for a couple of months and met with very senior leaders in Illinois early in the morning in downtown Springfield while I was still working. And they helped me launch my campaign.
It would come as no surprise that many people think that Dick Durbin in Illinois is unbeatable. I presume you are not on a fool's errand and that you think that you can defeat Dick Durbin. What makes you think you can?
Well, this is the thing that really galled me, is that that is the prevailing thought, even within the Republican Party. And I was going to retire comfortably in 3 years, but I just couldn't tolerate the idea of a Dick Durbin coronation. And I didn't want to golf and garden and read and write while Rome burns. So I have decided to take this on. And there is, in fact, a pathway to success in defeating Dick Durbin. I can expand on that.
Sure, yeah, go ahead and tell us.
You know, after the president is acquitted, it is my prediction and that of many others that there will be a red wave sweeping across the heartland and through Illinois. So that's one thing. The other thing is that in the Chicago area and in other communities in Illinois, President Trump is polling better among African Americans than all previous Republican presidents, at least in the modern time. In addition to that, Willie Wilson, who is really loved in the South and West ends of Chicago. He has run for political office several times, but he's a very generous man. He owns a medical supply company, and he's really generous with his money and has supported the Black communities in Cook County. He has decided to run as an independent in the general election for U.S. Senator. And I believe all of this combined would allow the successful nominee for U.S. Senator in the Republican Party to obtain 20% of the vote in Cook County, which is required.
So let's get into your issues. If Dr. Tom Tarter became the U.S. Senate Senator from Illinois, how would Illinois be better off? How would the nation be better off? What would you change from what Dick Durbin would be doing?
Well, Terry, I've seen the devastation caused by illegal immigration when I did my medical training at the County Hospital of Los Angeles. I operated on many illegal immigrant gang members who were shot or stabbed among the chaos in East Los Angeles. So immigration reform is number one in order to keep our neighborhoods safe. I want to help with tax cuts and regulatory relief. And I want to stop the left-wing liberal Democrats from socialized medicine with a single-payer health plan.
As you walk around Illinois, as you've talked to people in Illinois, what are some of the primary issues that the voters are focusing on as you talk to them?
Among the Republican groups that I interact with, immigration is the number one issue. We need secure borders. The open border policies and sanctuary laws that Dick Durbin supports are making our communities unsafe. And in fact, it's unsafe for the illegal immigrants, the people that he purports to support. So we need strong borders. I would support full funding of the Homeland Security Department appropriations to have a secure border, including completion of the wall, technology, and more CBP officers and immigration and customs enforcement officers. We have to secure our border first and foremost. Beyond that, we need to adjudicate the asylum claims fairly and humanely, but much more expeditiously. I mean, we've got to solve the backlog of the asylum claims. I would like to have more courtrooms and judges on the border, in addition to the family detention centers. I don't think illegal immigrants who have asylum claims should just be released into the interior because many of those people will not show up for their court dates. I also agree with the president that if you travel through a country and don't seek asylum there, then you don't have a claim here. In addition to that, I believe that our legal immigration system needs to change, needs to transition, I should say, from a family-based system of chain migration that we have now to a merit-based system. And I think we need to get rid of the country caps and the lottery. We need to constantly evaluate the needs of our country for the future. And in fact, I believe we need more immigration, not less. My neighborhood isn't a very big neighborhood, but we have families who are naturalized citizens who immigrated here legally from India, Pakistan, Syria, Jordan, and Hungary. I mean, that's a pretty mixed neighborhood. My kids grew up with their kids. These are wonderful citizens who have completely assimilated into American society, and they're highly productive people. This is what we need for our country. So as we evaluate our needs for labor, technology, education, and professional services, we should let people in that have what we need. And they should speak English. That's not an absolute requirement by the Constitution, but they should have minimal English language skills. They should have a desire to assimilate into our country.
Many people have gone to the hospital or doctor, and they've had a foreign doctor. When we look at immigration, to what extent should we be looking at the qualities that an immigrant brings in, or should we have the door open for whoever wishes to come into the United States? Let me just leave it at that.
Well, I think American citizens need to decide who is going to join the American family. I think it's as simple as that. It is our right to control our borders and immigration. Now, we have H-1 and H-2 visas. If a person's here on a visa, they're certainly welcome to enjoy all the benefits of someone living here on a visa. What I don't understand is why we have these artificial limits on the number of visas and on the number of people coming in with green cards. I would like to get rid of all the caps and just allow the people in as our country needs it. It's got to be flexible year after year.
Is immigration, you say you hear that a lot from the voters, is that something that you think Dick Durbin's policies are okay or especially egregious?
Especially egregious. Dick Durbin doesn't have a policy. His policy is purely based upon politics. He wants the Latino vote, period. And so he panders to the Latino community, and he is for open borders. He is for sanctuary laws. Sanctuary laws actually make our neighborhoods unsafe. I have met with families, 3 in particular, who have had loved ones who were killed by illegal immigrants who had criminal records who were then released from custody. These families will not have any justice. And I don't think Dick Durbin has an answer for that. Sanctuary laws truly make our communities unsafe.
When
excuse me, but I don't think most Americans actually believe this. They should meet with these families. Brian McCann heads an organization.
And who is Brian McCann?
Brian McCann is a man who lives in Chicago. I met him in Springfield. His brother, I think he was an insurance agent. And I don't know, maybe 7 years ago, he was walking across a street in North Cook County, and he was hit by a drunk driver who was an illegal immigrant who already had a history of DUI. He was in custody, released from custody because of sanctuary laws, and they believe he is now living in Mexico. This is wrong. So I don't know what Dick Durbin's answer to that is, except that it's not right. You know, Immigration and Customs Enforcement isn't engaged in massive raids of large communities of illegal immigrants. They're here of their own volition. American citizens didn't go to Mexico or to Central America and bring these people into our country against their will. No, they came in. And if they're living in the shadows, I'm sorry, that was their choice. All right. If they want to be legal citizens, if they want to work with a green card, they have to come in the right way. And they still can. That's the thing. But Dick Durbin and his fellow radical left-wing Democrats want them to have special protections. In Illinois, they're allowed to have driver's licenses. I absolutely do not support that. I do not support them having health care that is paid for by American citizens. I do not support them having education, which is paid for by United States citizens. They really need to come in the right way, but there's so many. Who knows in this country how many there are? Some estimates are 20 to 30 million. So if they want to come in the right way, they can. And I would support that. But I do not agree with amnesty. I don't think any immigration bill should include amnesty, except for a very tiny group known as the Dreamers.
Let's, time is always shorter than we wish. I'm sure a lot of people would, since you spent your career as a medical doctor, and healthcare is always so high on the list of discussions, and with people paying so much of their income now to healthcare costs, we hear people like Bernie Sanders arguing we ought to have Medicare for all, and the government basically take over the healthcare system. I know you oppose that, but can you go into detail? Why do you think that's a bad idea from the standpoint of one who has obviously dedicated his life to curing people and working on solving healthcare issues? Why would that be bad? And what would you say is a way that we could have maybe better healthcare at lower costs?
Well, Terry, another report came out in May 2018, other than the Mueller report. Of course, the Mueller report just overshadowed everything that was going on in Congress. But the report that came out was a Congressional Budget Office report on a single payer system in the United States. This was requested by House Democrats, and I have no idea why they requested it. Because if you read the CBO report, you really wouldn't want a single payer system. It points out basic fundamental economic truths that when you make a service seemingly free, the demand for that service goes way up. When California expanded Medicaid, emergency room visits across the state increased by 20%. That's a very inefficient way to deliver healthcare through the emergency departments. But that's what happened because Medicaid is perceived as free healthcare. There's no cost sharing. So when you make this seemingly free and the demand goes up, the only way to control costs in that system is to either reduce services, that translates into rationing of care, in this case, extreme rationing of care, and you have to reduce reimbursements, which means a loss of providers.
And by reimbursements, what the hospitals are paid, what the doctors are paid.
Hospitals and doctors are paid. So you reduce the reimbursements, and you're going to have small community hospitals closing, and you're going to have a loss of providers. And we're already 90,000 doctors short in this country. So what happens in countries that have national health insurance or a national health system? Dick Durbin says healthcare is a right, not just for the wealthy. Well, the wealthy in those countries take their healthcare dollars where they get the value for their dollar. So, for example, 60,000 Canadians cross our border every year to purchase healthcare services. India's medical travel industry this year is going to be a $9 billion industry. So the wealthy will always take care of themselves. It's just the middle class that's going to get really hurt by a single payer system. There are common sense, market-driven solutions to reduce the cost of healthcare. Republicans need to lead.
What's some of the low-hanging fruit that would allow the United States to have better health care without bankrupting its citizens?
Well, let's put the drug costs aside for a second and get back to it, because that is a significant issue. It's a moral issue. I have to have an EpiPen around me at all times because I can have an anaphylactic reaction to certain foods, and I don't know what those foods are sometimes. So I've gone to the hospital about 6 times to treat a very serious reaction. So I have to have an EpiPen. Well, the EpiPen scandal was terrible. I can afford the EpiPens, but most people can't. So we'll get back to the drug issue. I think, I hate price controls, but I think Congress has to step in when you have this unethical pricing of life-saving drugs. But for the health insurance, the customer, which is the union or the employer, or like me, the individual, now that I'm on Medicare, since I'm fully retired, those costs can be reduced. The president already has a transparency rule in place, which has been
you mean a price transparency?
Price transparency.
And you're in favor of that?
Absolutely. This is actually in a white paper that I wrote, which is on my website. I've written a fairly lengthy white paper on U.S. healthcare policy. It's really not, we don't really have a free market of healthcare. Insurance companies set prices with provider groups. That's hospital systems, physician groups. But those deals are carefully guarded secrets. The American Hospital Association has spent $20 million lobbying against the transparency rule. So I'm not going to get endorsed by the Illinois Hospital Association, I guarantee that. Because when you don't know the value of your healthcare dollar, that is the best outcome for the least cost, then the prices vary hugely. In cities, a single surgical procedure can vary by 400% of Medicare fee for service. And the reason for that is that the customer, the union, the employer, or the individual doesn't know the value of their healthcare dollar. So let's make it a true free market. And I guarantee you the price is going to come down, okay? That's just one of many things that we can do. Increasing the dollar amount and the use of health savings accounts would make a big difference for middle-class families.
For those who don't know, what is a health savings account?
A health savings account is money that is set aside in an interest-bearing instrument, kind of like it's an interest-bearing instrument held by a bank.
Kind of like a medical version of a 401k or an IRA, right?
Right,
so they
exactly.
Can set money aside and it builds up over time when you're healthy. Exactly. And then when you need it, you can utilize that money.
You can utilize it, but there's a lot of
healthcare, right?
But there's a lot of restrictions on how you can use that. I think we need to get rid of a lot of those restrictions. We also need to improve the dollar amount. People should be allowed to save for their healthcare expenses. And yes, if you're healthy for an entire year, that account rolls over to the next year.
Is there anything we can do or should do to control the charges. I mean, we can, as you say, if we, as I think given where we are right now, I believe the president has already required hospitals to start posting prices. It's just that that's not going into effect yet. I forget the effective date.
Well, but the price of insurance isn't transparent. Okay, so the deals need to be exposed. All right, and we need to really have true price transparency. What about primary care membership plans? You know, for example, a family of 4 for $150 a month can have all of their primary care healthcare needs done. You know, the x-rays, the lab work, the doctor visits, the health maintenance, especially for those who have chronic conditions. That eliminates the government and the insurance companies because it's direct payment to a primary care group. Those plans are wonderful.
And so that way you don't break the bank just to go in for your checkups, your inoculations, that
Right.
kind of thing. Or if you have just the common cold or whatever,
Right.
you can go in and have insurance directly with the provider. Is that it?
Right. What about regulatory relief? You know, Dick Durbin says, I want doctors treating patients, not fighting with insurance companies. Well, I am a doctor. I've done this for 23 years. Fighting insurance companies, which you have to occasionally do, pales in comparison with staying in compliance with Medicare regulations. In 2018, compliance with Medicare regulations, which had nothing to do with patient care or patient safety, cost $34 billion. I want to know Dick Durbin's answer to this. He's not a doctor. He's never dealt with Medicare regulations that have nothing to do with patient safety or health outcomes. We need regulatory relief. We also need tort reform. His campaign was, his last campaign for United States Senate was funded partially by lawyers. They gave $1.4 million to his campaign. He's not gonna want tort reform, you know, for non-economic damages. You know, some of these judgments are wild.
Have you seen, I don't want to make it just about you, as you talk
Right.
to other doctors, as I'm sure you do, to what extent have your insurance costs to protect yourself against medical malpractice charges, to what extent has that cost gone up for you as a provider?
It only goes in one direction. As a provider, you know, providers also need to know how to protect themselves. Providers themselves have to be transparent and completely honest. I've done some of the most major cancer operations in central and southern Illinois, and I've never been to a courtroom, and I have never settled a case. I've been named in lawsuits, but always dropped. And the reason for that is complete honesty and transparency with the patients. We're human beings, we make mistakes. But if you admit those mistakes and you do whatever you can to mitigate whatever problem resulted, then you're not going to get sued. So doctors can protect themselves also. But, you know, I've been named in some lawsuits that were just never going to go anywhere because there's incentive for lawyers to do that because there is no tort reform.
I don't want to go on too long here, but is there any specific tort reform that you would propose?
Yeah, limiting the non-economic damages.
Pain and suffering, basically.
Yeah. So.
Let me go back to when we talk about, you said you're on Medicare now. We have Medicare, for those over 65, basically. We have Medicaid, which is health insurance coverage for the indigent. I'll point out to people, and I know the last thing probably anyone wants to read is the trustees report put out by these programs, but the trustees of Medicare and Medicaid, as well as Social Security, are saying none of these programs are properly funded and are not sustainable. And we ought to have that knowledge when we have people, as Bernie Sanders saying, we ought to all go on there. It is estimated that the cost of doing that would bankrupt the nation, as they are right now, these programs are. So it's always a dicey proposition for the Congress to form a program where we can make sure that people are covered in health care, but at the same time, not in such a way that we bankrupt the nation. I don't know if maybe perhaps that's because our policies have been written by lawyers instead of doctors. I'm not sure. I sometimes question what our judicial system would be like if judicial system regulations were written by doctors instead of lawyers. But that said,
That would be better.
that, let me ask as we conclude, why don't you give us a wrap-up of what you would do on behalf of the citizens of Illinois if you were elected in terms of immigration, economics, and the health care, and just kind of maybe more of a concise summation.
Well, you mentioned the third rail of politics, which is entitlements, Social Security, Medicare. I have done everything and more in my life than I ever imagined. I am not beholden to anyone. I will touch that third rail. Dick Durbin will not. He's a career politician. So he's not going to reform or save Social Security. I will make every effort to do that. You know, both Social Security and Medicare are important safety nets. And in terms of Social Security, people really don't understand how it works. In fact, there is no real trust fund. The trust fund has been raided over the years and replaced with IOUs, and those IOUs will run out in 2037. So there are ways to save the program, but it requires sacrifice on everyone's part. Social Security came about when the average life expectancy was 61 years. So if a person ever got a check, they beat the odds, because the retirement age of 65 hasn't changed in all of that time. We need to index the retirement age to life expectancy. And there are solutions. You can raise the Social Security tax, which I don't favor. You could have a standard benefit for everybody. It's the same, but that means that the lower end beneficiaries would get more and the higher end beneficiaries would get less. That requires a sacrifice. And there are other ways to save the program too. But politicians are afraid because these things are unpopular with most Americans, Democrat and Republicans, but you've got to do the right thing to save these programs, or they're not going to be sustainable, and the taxes are going to go way up, which people also don't want. In terms of Medicare, the same thing applies. You've got to adjust the age of the beneficiaries to the retirement age. Congress has done a pretty good job of saving Medicare, honestly. They've made many changes over the years, and the latest one was the Medicare and Chip Reauthorization Act, called MACRA. It's too early to tell how well MACRA is working, but it changed the payment system for providers to a value-based system. So we just have to see how that works for the system. I prefer what Paul Ryan did, and that's premium support, which is based on income and based upon pre-existing conditions. There has to be some cost sharing. People have to have some skin in the game, or the costs go, the costs are really high. It's unaffordable. So those are some of the things I would do with the entitlements. I'm not afraid to tackle the entitlements. Dick Durbin is. And I think I can make the case to Illinoisans. In terms of immigration, I think we need to have a fair and humane immigration system, and we need to make it work for the needs of our country. And in terms of healthcare, we already discussed that in some detail, but we need to make changes which will reduce the cost of healthcare. We don't need to spend 17.5% of our GDP on healthcare, and we can reduce the cost of health insurance and healthcare overall.
You know, where we began with talking about how many people think that Dick Durbin is going to be unbeatable. We're not promoting your candidacy over Dick Durbin's, but that's a presumption. I will share with people that when I interviewed Barack Obama, who was running for the U.S. Senate back in November of 2003, at that time, no one thought he had a chance to be elected to the U.S. Senate. So the idea, however, is that we at the Illinois Channel think that the citizens ought to have the right to hear what the candidates' ideas are and to present those so that the voters will have a better idea. And hopefully we've done that today. And Dr. Tom Tarter, we've put your website up. If people want more information, they can go and look at some of your policy positions. As much as we covered today, we can never go anywhere near as much in depth as we would like. We would be talking to you for 3 or 4 hours, I presume, but we do appreciate your time, and thank you for joining us. And should you be the nominee, the primary on March 17th, then we would certainly look to revisit with you and go over issues as we go toward the fall campaign.
Well, I appreciate this very much, Terry. You know, as a surgeon, I never left anything to chance. I do a lot of homework, and that homework actually included reading a chapter on politics in Barack Obama's last book, The Audacity of Hope. And I learned quite a lot about how he got elected to the United States Senate. So I do my homework. That sets me apart from the other candidates. And I hope the voters will put their trust in me on March 17th.
Dr. Tom Tarter, candidate for the Republican nomination for the U.S. Senate, we appreciate you joining us on the Illinois Channel.
Thank you very much, Terry.